There's a critical system silently operating within our bodies every second, every minute. Our network of blood vessels. It brings life to every cell. But precisely because it's silent, when problems arise, when blood vessels start to get blocked, the initial warning signs are often subtle and easily missed, hiding potentially dire risks. So, who is at higher risk for this kind of vascular blockage? Besides age, especially as we enter middle and older age, several other factors play equally important roles. A family history of early cardiovascular disease is a genetic factor we can't change, but one we must be very mindful of. Additionally, lifestyle has a huge impact. Smoking, whether active or passive, an unbalanced diet high in saturated fats, trans fats, and bad cholesterol, eating too much salt or sugar, combined with a sedentary lifestyle, being overweight or obese. These are all leading culprits eroding our blood vessel health. Underlying conditions like hypertension, high blood pressure, diabetes, and dyslipidemia, high cholesterol or triglycerides, also significantly increase the risk of plaque buildup and blockage. Knowing if you fall into a high-risk group helps us be much more proactive in screening and prevention. Today, we'll decode 4 of these early signals together to protect our health. First is prolonged difficulty breathing or shortness of breath after physical activity. Everyone breathes faster after exertion. That's normal. But if you find yourself panting for a very long time before recovering, with a prolonged racing heart, feeling like you just can't get enough air, don't take it lightly. This isn't just a sign of heart strain. It could also indicate that your body's ability to exchange oxygen is being affected by poor blood circulation. If you experience this, get checked early and temporarily avoid overly strenuous activities. Second is a change in temperament, becoming more easily irritable or annoyed, sometimes for no clear reason. Many attribute this to stress, but realistically, when high blood pressure occurs or the brain doesn't consistently receive enough blood and oxygen due to vessel issues, emotional regulation and cognitive functions can also be affected. It causes fatigue, makes emotions difficult to control, reduces concentration, and can even trigger sudden dizziness or headaches. If this happens frequently without a clear cause, consider getting your cardiovascular health checked. Third is the sensation of constantly ice-cold hands and feet, or leg pain, aching, or numbness. When walking a certain distance, hands and feet are the outskirts that blood needs to nourish. When blood vessels are narrowed or blocked, insufficient oxygen-rich blood reaches these areas, causing coldness or numbness. Particularly, the symptom of calf pain when walking, a cramping, aching, or heavy feeling that forces you to stop and rest before the pain eases enough to continue, known medically as intermittent claudication, is a very typical sign that blood vessels in the lower limbs are blocked. This condition isn't just uncomfortable. If prolonged, the lack of blood flow can lead to tissue damage, ulcers, and poor wound healing in the legs. Fourth, and a sign requiring special attention, is sudden chest tightness or chest pain. The sensation might feel like heavy pressure, squeezing, fullness, or a sharp stabbing pain, usually in the center of the chest behind the breastbone. This pain might radiate to the arms, often the left, shoulders, neck, jaw, or even the back between the shoulder blades. Even if the pain is brief and then subsides, you absolutely must not ignore it. This could be a warning of extremely dangerous conditions like unstable angina or a heart attack, indicating that a part of the heart muscle may be severely lacking blood, risking tissue death, necrosis, if not treated immediately. You need to seek emergency medical attention or get checked right away. Ignoring these warning signs and failing to seek timely intervention can lead to very severe complications. Blocked blood vessels in the heart cause heart attacks and heart failure. In the brain, they cause strokes, potentially leading to permanent disability or death. In the legs, it can lead to chronic pain, tissue death, gangrene, and even amputation. It also seriously affects kidney function, causing kidney failure, and impacts many other organs. Therefore, early recognition and action are crucial. So, how can we proactively protect this precious vascular system and minimize those risks? The first thing seems simple, but is incredibly important. Get adequate rest and sufficient sleep. Chronic sleep deprivation puts the body under stress, causing it to release more hormones that constrict blood vessels, raise blood pressure, slow blood flow, and make blood thicker. This increases the risk of clot formation and blockages. Aim for 7 to 8 hours of quality sleep per night. Second, we must talk about a scientific diet. Be a savvy consumer. Try your best to minimize foods high in saturated and trans fats, often found in processed foods and deep-fried items. Limit sodium, salt, and reduce refined sugars. These are enemies of healthy blood vessels. Instead, befriend the heroes that protect them. Increase fiber from dark leafy greens like spinach, kale, beans, fresh low-sugar fruits, and whole grains like oats, brown rice. Add healthy fats from fatty fish like salmon, herring, and sardines, rich in omega-3s, or from avocados, nuts like walnuts and almonds, flax seeds, chia seeds, and use extra virgin olive oil. And don't forget to drink enough water daily, around 1.5 to 2 liters, about 6 to 8 glasses, or more depending on your body and activity level, to help thin the blood and improve circulation. Third, maintain regular physical activity. Exercise helps improve blood circulation, control weight, blood pressure, blood sugar, and cholesterol levels. It doesn't necessarily have to be high-intensity workouts. Aerobic activities like brisk walking, cycling, swimming, yoga, tai chi, dancing, for about 30 to 45 minutes a day on most days of the week, bring significant benefits. If you're just starting or have underlying health conditions, consult your doctor to choose the appropriate type and intensity of exercise. The key is consistency, regularity, and listening to your body. Fourth, a critically important factor to eliminate. If you currently smoke, make a firm decision to quit immediately. Smoking is one of the most severe damaging agents to blood vessel linings, accelerating atherosclerosis, hardening of the arteries, causing vessel spasms, and increasing the risk of blood clots. Quitting smoking at any age brings significant and immediate health benefits. Fifth, don't forget effective stress management. Chronic stress also contributes to high blood pressure and negatively impacts overall cardiovascular health. Find relaxation techniques that work for you. Perhaps meditation, deep breathing exercises, yoga, spending time on hobbies, reading, listening to music, maintaining positive connections with friends and family, or seeking professional support if needed. And finally, but no less important, never underestimate regular health checkups. Routine visits, at least every 6 to 12 months, or as recommended by your doctor if you have underlying conditions, aren't just about measuring blood pressure. Your doctor may order necessary tests like a lipid panel, cholesterol and triglycerides, fasting blood sugar, HbA1c if at risk for diabetes, kidney function tests, and depending on the situation, may need an electrocardiogram, ECG, heart ultrasound, or more specialized investigations. Don't hesitate to openly discuss your concerns and any unusual symptoms you're experiencing with your doctor. Early detection is the golden key to timely intervention effective risk factor management, and preventing dangerous vascular complications. Hopefully, with the information just shared about recognizing the signs and preventing vascular blockage, you've gained useful insights to proactively manage your cardiovascular health. If you find content like this essential and want to stay updated with more reliable medical knowledge, please don't hesitate to hit the subscribe button and turn on the notification bell so you don't miss our latest videos. Your support is great motivation for us to continue this meaningful work. Vascular health is the foundation for an active and long life. Think of caring for your blood vessels like tending to a precious garden. Listen to your body. Don't ignore even the smallest warning signs. Proactively adopting a positive lifestyle, eating scientifically, exercising appropriately, managing stress, quitting smoking, and getting regular checkups is the best way to protect yourself and enjoy life fully with your loved ones. Wishing you all continued health and peace.